Hello, everyone. Welcome to this episode of Criminal Mischief, the Art and Science of Crime Fiction. I'm your host, DP Lyle. Thanks for joining me. I get asked questions by writers all the time, and by far one of the most common is they're looking for a drug that will cause a heart attack. Obviously, one character wants to get rid of another one. They want to make it look like a heart attack to throw off suspicion that it was murder, that it was more of a natural event. You know, these things happen. What can you say, especially in crime fiction? But the simple answer to that question is no. There is not a drug that will reliably cause a heart attack. And murderers usually want whatever they do to be reliable. This is why when they give a poison, they total overkill. They probably only get one shot at this and they want to make sure it works. But let's talk about what is a heart attack. Well, that's the lay term, and actually we physicians use it too, for a myocardial infarction, or MI for short. Myocardial means heart muscle, and infarction means death of the heart muscle due to lack of blood supply. So if you look at the anatomy of the heart, it's basically a pump, and it pumps the blood around the body. Everybody knows that. The coronary arteries are the arteries that sit on the surface of the heart, and they sit over it like a crown. In fact, it comes from the Latin corona, which means crown. So these coronary arteries crown the heart, where they also supply blood to the heart. They send out branches that soak the heart muscle with blood, and it needs it all the time because the heart works for a living. It needs blood and oxygen all the time to keep functioning. But what if one of those arteries gets blocked? Usually this is by atherosclerosis, damage from hardening of the arteries, and then there will build up plaques in there, which are little lumps and bumps of cholesterol build up and hardening of the arteries, if you will. And one of these will crack and a blood clot will form, and that will completely block or occlude the artery. Well, now no blood is going down the artery to the tissues that it is supposed to supply. And the heart muscle quickly begins to die. And this is called a heart attack or myocardial infarction, death of heart muscle tissue due to poor blood supply. All right. It can be major, it can be minor, it can be deadly, it can be aggravating, it can change your life though. Okay, so how would you do that? What drug could you give that would cause a blood clot to form in a coronary artery in any predictable fashion whatsoever? Well, the answer is that there is none. So you can't cause a true heart attack by giving someone a medication of some type. But you can do things that would simulate a heart attack, and to the average person, it would look like one. One of the classics is cyanide. Now, when someone has a heart attack, what happens? Usually their symptoms are first they develop chest pain, a pressure, a tightness, and aching. It's usually right in the middle of the chest. It can radiate into the arms or the neck or down to the abdomen. Everybody senses it differently, but chest pain is the big symptom. Along with that, it almost always is shortness of breath and, interesting, a feeling of like impending doom. People know that something bad is going on. You know, it's not like a toothache and it's not like a broken bone even. You just have this feeling that something bad is going on. Also, you can get sweatiness, you can get nausea, you can get vomiting, you can get dizziness, you can even faint. All of these things can happen with a heart attack. Well, what happens when you take cyanide? Well, when you take cyanide, it poisons the cytochromes inside the cells so they can no longer use oxygen. And it works very rapidly. And cyanide can be absorbed either by inhalation of a powder or something. It can occur because of ingestion, and it can even absorb through the skin. And when it does, it works very quickly, and it's as if all the oxygen was removed from the body instantaneously. And so the cells and everything starts dying and you die very quickly. The symptoms are chest pain, shortness of breath, dizziness, and fainting. It can look exactly like a heart attack, and it can be very dramatic and look like someone collapsed from having a heart attack. So that would work. It would at least would simulate it. Next would be amphetamine things, cocaine, crystal meth, all these speed things, okay? And this happens all the time. People who use these drugs end up dying of a cardiac death. What do I mean by that? Cardiac deaths in the end always come from a change in the heart rhythm. It's not so much damage to the heart, it's that it makes the heart unstable electrically. And you develop usually what we call tachyarrhythmias. Tachy means fast, arrhythmia means heart rhythm, okay? So a tachyarrhythmia is something that goes fast, and these are usually ventricular tachycardia, where the heart takes off racing at over 200, or ventricular fibrillation, where the electrical circuits inside the heart muscle just become chaotic and swirly like a hurricane, and no cardiac function follows that. The heart just sits there and quivers, so there's no pumping action. This leads to death very quickly. Those can happen with a heart attack. They can also happen with stimulants such as amphetamines. So if you give someone a dose of crystal methamphetamine, it's enough of it. One of the ways that they could die is that, and probably the major way they would die from this, is they would develop electrical instability in one of these dangerous cardiac rhythms and would collapse. So what would it look like? So someone would take in the crystal meth, they would stand there for a few minutes, and they would start feeling palpitations, which is a sensation that the heart is racing. They might get dizzy, they might have chest discomfort, they might get short of breath, they might get sweaty, and the next thing you know, they hit the floor and they're out and gone. And then, unless CPR and all that's performed very quickly, they are gone. It looks like a heart attack, and that can happen. One of the most interesting medications in the history of medicine is digitalis. It comes from the foxglove plant. It's a deadly poison. They used to use it in South America to bring down, water buffaloes or whatever. They used it to hunt. It's deadly. But it's been, for over a century, well over a century, a major cardiac medication. It does a couple of things. It's mainly used in either heart failure to help strengthen the heart muscle, or it's used in arrhythmias, particularly like atrial fibrillation. Now, digitalis now is used much less than it was when I first started medical school, and much less than it was in the 1920s and 30s and all of that. It was very common, and it still is very common, and it's very accessible. It comes in made by a lot of companies under a lot of trade names, but basically it's digitalis. And when it is ingested, it does good things as far as regulating certain heart rhythms, but it can also, as most things are a double-edged sword, it can cause deadly cardiac arrhythmias. If you get too much digitalis on board and the levels in the blood go up, it can cause these deadly rapid heart rhythms that we talked about, ventricular tachycardia and ventricular fibrillation. Oh, and by the way, it can also slow the heart rate by causing a block. Now, the electrical circuits of the heart work so that up in the upper chambers in the atria, the electricity goes through there first. It hits a little relay station called the atrioventricular node. What it means is it's an electrical node that's between the atria of the upper chambers and the ventricles of the lower chambers, and it's delayed a few milliseconds there, and then it goes on down to the lower chambers. It has to do with the physiology and how the heart works. Well, digitalis can actually slow things through that node, even block them completely, and you can end up with a heart rate that falls into the 20s and 30s. This also will not sustain life, and you can fall dead. So digitalis can kill you several different ways, but they're cardiac arrhythmias that do it. Now, when someone's given digitalis, we draw blood to check the level of the digitalis in the blood. The dose is very small. It's only 1/4 of a milligram is the average dose, 0.25 milligrams. And then we would test it frequently when someone is on it, because if it's too low, then you're not going to get the desired effect, either controlling the arrhythmia or whatever you're giving the digitalis for, or too high, you get into a thing we call digitalis toxicity. And when the digitalis level goes up, people get nauseated and vomiting and feel terrible, and the next thing you know, they have major cardiac arrhythmia like I described and die. It happens all the time. Now, older people get their medicines confused all the time, or a lot of patients, yeah, you'd be surprised, say, well, if one's good, 3 must be better. And so they end up taking 3 times what they're supposed to be taking because they don't pick up the phone and ask questions. But that's another issue. So digitalis accumulates. So if you take too much for 2 weeks in a row, the next thing you know, your level is very, very high. And now you're subject to these cardiac arrhythmias. This happens in nursing homes. It happens at home. It happens with the elderly because they get their medications mixed up all the time. So if someone wanted to murder someone who was older, they'd just monkey with their medications and double or triple the dose of the digitalis, maybe add some to their food besides what they're taking, and 10 days later they start getting nausea and feeling puny, and you think, well, you got a little flu bug, and the next thing you know, they wake up dead. So that's not a heart attack, though, but it can simulate one. If you get a 75, 80-year-old guy who doesn't wake up some morning, and he has heart disease and he's on medications, chances are something cardiac happened during the night, and that's the end of that story. So that can work. So you can see that there are options for the writer who wants to use digitalis. Okay. What other drugs? Well, there's other drugs used for arrhythmias, particularly the beta blockers. There's a whole group of those, and what they do is block the effect of adrenaline on the heart and slow the heart rate. They are used to treat these tachyarrhythmias I talked about. There's others, not the ventricular tachycardia and ventricular fibrillation, though they can be used in VTAC. But they're used for things called atrial tachycardia, atrial fibrillation, and they slow the heart rate down. They're also used for blood pressure because they lower the blood pressure. So an excess amount of these, which also can accumulate, usually over 2 or 3 days, it works much faster, can have a drop in blood pressure and a drop in heart rate. The person can drop dead, and this also can simulate a heart attack. So you have options for simulating a heart attack, but you can't cause one. And what that means is that at the end of the day in a sudden death, if there's any question as to the cause of death, the medical examiner may do an autopsy. It's his choice. He either will or he won't. If an inheritance is at stake or if they're suspecting foul play, you can bet he's going to jump in the middle of it. And what's he going to do? Well, when he examines the heart, he's going to say, well, there's no thrombosis in here. There's no clogged artery. There's no damage to the heart muscle. This was not a heart attack or a myocardial infarction, he would say. So what could it be? Well, it must have been a cardiac arrhythmia. Well, people with coronary artery disease die of cardiac arrhythmias all the time, and there is no anatomical evidence of that. None, zero. It's an electrical event, so it doesn't alter the anatomy in any way. It only alters the physiology. So in an anatomical look at the heart, you don't see anything. But then he's going to start looking. And amphetamines and digitalis and beta blockers are very easy to find in the blood or in the stomach contents. And so consequently, if they find someone has 2 or 3 undissolved digitalis pills at a digitalis level that's 3 times normal, you're going to say, well, this was a cardiac arrhythmia due to digitalis toxicity. Why and how and for what reason did he take too much digitalis? Was it an accident? Was it a suicide? Happens all the time. Or was it homicidal? Did someone give it to him surreptitiously and he end up digitoxic and dead? So these things can be found. These drugs can be found if they are looked for in an autopsy and a toxicological examination. So back to the question. Is there a drug that will cause a heart attack? No, there is not. Not in the purest sense. Is there a drug that will cause a sudden death that looks like a heart attack? Yes. Cyanide, amphetamines, beta blockers, digitalis, all of these can be suspect in this. So I hope this helps you when you're crafting your stories, and I hope you don't make the mistake of saying we're going to give this guy drug A and he's going to have a heart attack and die, because he's not going to have a heart attack. Now, it may look that way to the layman, but when you get the medical examiner and the medical people involved in your story, they're going to know the difference. And so you need to know the difference so that you don't look foolish on the page. We never want to look foolish on the page. So that's it. This is DP Lyle. I'm your host at Criminal Mischief, the art and science of crime fiction. And you know we'll be back with other shows. Until then, keep reading, keep writing, keep having fun, and try not to get caught whatever you're doing.